I call the member for Port Stephens.
Thank you, Mr Assistant Speaker. I rise to contribute to this motion from the member for Port Macquarie. The member and I co-chair the Parliamentary Friends of Dementia Group, and we also share the pleasure of representing areas where many people like to retire. So issues facing older communities are of high importance to us both, as it is for many members in this place. As the Acting Shadow Minister for Ageing and the representative of the Shadow Minister for Health, the Honourable Walt Secord, in this place, and as the member representing the area recognised as being the oldest in Australia, the availability of palliative care is an issue of great concern to me. Speaker, around 12 months ago I had the opportunity to attend a palliative care roundtable in Newcastle, and it was a very informative event. It produced a good quality summary of the needs in the sector. At the event, I had the opportunity to speak with a number of medical staff, families and advocates working in the sector, and to discuss with them what they see on a day-to-day level. The workshop heard from a palliative care specialist who spoke of patients' desire for a good death and what that can mean for different patients. They also spoke about care is an ecosystem which encompasses a cultural, religious and social context, as well as a health context. The importance of making care decisions in advance was stressed as well. Another speaker was an advocate who lost her young son in 2004. What can only be the most traumatic event in anyone's life was made worse by being in an acute care setting for her son's final weeks. Through her advocacy, a child and adolescent palliative care service is now available at the John Hunter Hospital. And this is a very different model of palliative care to that experienced or needed by older people at the end of their lives. Another speaker mentioned who spoke was a palliative care nurse, and she talked about her work collecting data on how people choose to die. One disturbing point she mentioned was the huge turnover in palliative care staff over the last 12 months and the impact this has had when teams lose those advanced and experienced skills. Throughout the palliative care roundtable, there were discussions on the workforce, the importance of communication, the role of volunteer assistance, the need for service flexibility, the focus on patient-centred care, the work to integrate palliative care into other parts of the health system, and recognising the need for palliative care links outside its common focus with oncology. I'm pleased it is the Parliamentary Secretary for Regional and Rural Health who has raised this issue today, because in August last year the New South Wales Auditor-General issued a report into palliative care which highlighted the significant disparity in access to services across New South Wales, as well as the overall lack of planning to ensure that there are adequate palliative care specialist health professionals across New South Wales. I've spoken before about the desperate need for increased palliative care in my community, both in the home and hospital setting. And nowhere is that demand felt more clearly than in regional electorates such as mine. The Auditor-General's report was in stark contrast to some of the glowing language that is used about palliative care in this place. Their report found that, and I quote, "New South Wales Health's approach to planning and evaluating palliative care is not effectively coordinated. There is no overall policy framework for palliative care and end-of-life care, nor is there comprehensive monitoring and reporting on service and outcomes. New South Wales Health has a limited understanding of the quantity and quality of palliative care services across the state, which reduces its ability to plan for future demand and the workforce needed to deliver it. At the district level, planning is sometimes ad hoc and accountability for performance is unclear." And continuing from the Auditor-General's report, "The capacity of local health districts to use accurate and complete data to plan and deliver services is hindered by multiple disjointed information systems and manual data collections. Further, a data collection on patient outcomes for benchmarking and quality improvement is not used universally. This limits the ability of districts to plan, benchmark and improve services based on outcomes data. New South Wales Health's engagement with stakeholders is not systematic. The lack of an overall stakeholder engagement strategy puts at risk the sustainability and value of stakeholder input in planning and limits transparency." And another important quote, and I am dwelling on this report because when I read it, it confirmed a lot of everything that I was seeing and hearing from within my community and in other communities. Another quote from that report says that while New South Wales Health has identified significant gaps in the specialist palliative care workforce, especially in regional and remote areas, and it previously made workforce capacity one of its priorities, limited work has been undertaken in producing a statewide strategy to reduce these gaps. Now, the final section of this report, this is from an Auditor General's report. This is not my words, and I'm quoting again.
Order.
Under the New South Wales government plan, local health districts could access a flexible fund to enhance their palliative care services through an expression of interest model. However, this bidding approach may not support equitable service delivery, particularly for regional and remote populations. So again, we see this government taking a commercial approach to service delivery of something that is critically important. While I've spoken of the high turnover in palliative care nurses overall, in Port Stephens, 3/4 of our local palliative care nurses have 70th birthdays coming up. So the lack of workforce planning identified by the Auditor General is being played out in Port Stephens, and I have no doubt across many areas in New South Wales. Succession planning is desperately needed. At Tomaree Hospital, I'm told that there are dedicated palliative care beds, but no palliative care nurses. I hope that the New South Wales Government will be allocating one of the 30 palliative care nurses they announced in last year's budget to Port Stephens. Towards the end of the last year, I had the pleasure to meet with Port Stephens Palliative Care Committee and their President Rosemary Toscano. It is telling that in an area of the health sector that it requires a dedicated fundraising committee, and these fundraising committees are across rural and regional communities across New South Wales. And I know that these committees are raising for items such as pressure mattresses, oxygen concentrators, hospital beds, as well as RoHo cushions. These are basic and expensive items critical to the delivery of in-home palliative care, and it beggars belief that fundraisers are having to do it across New South Wales still. So in this National Palliative Care Week, what matters most is this: allowing people to live with dignity until the very end of their life. And I trust that this government will support communities to do that.
Hearing